As more and more states begin to reopen, some are raising questions about measures to protect the most vulnerable to the coronavirus. It has killed more than 247,000 people worldwide, with more than 3 million confirmed cases across the globe. The United States is the only nation with 1 million COVID-19 cases. The next 5 nations on the list all are in Europe. Let's bring in emergency physician Dr. Sudip Bose. He's also a medical director for Odessa, Texas Fire Rescue and an Iraq War veteran. Dr. Bose, as you look around the world, I mean, this virus is capricious, but why is the United States getting hit so much harder than so many other countries? Do you know?
It's a good question, and there have been many theories that have been made about this. If we look at what we do know, if you look back at, for example, SARS, which is another coronavirus in 2003, what happened then? If you look at the index case in Toronto, for example, which I'm going to compare the United States to now, there was a physician in China, and that physician was exposed to SARS patients, wasn't feeling well, went to a family wedding in the Kowloon province of Hong Kong, and infected people there. And then that physician ended up dying and stayed at a hotel, infected people in the hotel. Someone from the hotel went to Toronto, was the index case there, spread it to their family and emergency physicians. The point being that the initial spread is when, sometimes not even on the radar and when you don't know about it. At that point, SARS was not on the monitor as far as it being an epidemic at that time. So if you look at what's happened in the United States, whether it's the West Coast or the East Coast, those emergency physicians often were doing procedures like intubations and putting people in aerosolizing procedures and high-risk conditions without even knowing they were dealing with a COVID patient. Whereas other areas of the country got a little bit of a head start, got to prepare a little more. So the maximum spread is when you don't know it's at your shores, and if you're in denial, like that physician I discussed, and people are in denial and they're passing it to family members. So I suspect that's a part of it. There's also theories that there may be mutations and different variants of the virus as well.
You are a war veteran, a combat veteran, I should say. You're also in Texas, which is one of the states that's reopening. A lot of concern out there about, getting social gatherings back together, getting business back together. But there are also those who say that, the joblessness, the depression, the mental health concerns resulting from keeping this nation locked down are worse than COVID-19. Now, you're there in the emergency room in Odessa.
Correct.
Is your facility ready for what comes next?
Well, you're exactly right. What's happening, I talked to a couple patients today, and they're on two ends of the spectrum. One end of the spectrum is they're completely worried about death from the virus. And the other end of the spectrum are people who are vulnerable in other ways, not just physically, but the economic ravages of no money and the loneliness epidemic, and they're struggling. And both groups are vulnerable. And we have to acknowledge the politics of this. Unfortunately, this is becoming political, where people see their side as the only side that's correct. And it's human nature to look for sources and journals that validate your beliefs. So one of the hardest things is coming to the middle. And as a physician, I find that challenging, because even when I'm reading medical literature, you have to rule out the biases of that scientific literature, what might have gone wrong and right in that research study, and come to the middle and make a conclusion. So here in Texas, we're making the conclusion that we gradually open slowly, because, again, the truth is probably somewhere in the middle. And remember, we take risks all the time. We take risks when we get in our car and go to work. We could die in a car accident. We take risks when we decide not to get the flu vaccine every year. 50% of people don't get the flu vaccine, and they put themselves at risk for death and others. So we are taking risks even before COVID. So the question is, what risks do we take now? And how do we weigh that seesaw between the physical effects and then the economic effects?
I know that your fellow veterans are in some ways susceptible to COVID and maybe the depression that comes, with all of this that we've been talking about very quickly. What do you say to your fellow veterans right now?
I am confident our fellow veterans will stay strong. I mean, what we saw on the battlefield was horrific. And, whether it's blood, guts, tourniquets, whatever we're dealing with there. And obviously, we all know about post-traumatic stress. But that message, not only to veterans, but to fellow Americans and everywhere around the world, I think is that we have to stay strong through this mentally. So a couple of tangible things. Number one, catastrophizing. So you take something and make it into a catastrophe. It's human nature to do that. Oh my God, I got this virus, I'm gonna die. Or, oh my God, I'm gonna go bankrupt. Or maybe not. Like, we have to not catastrophize things and kind of learn to flip it and look rationally at what could happen. And then also just intellectualizing, learning more about it and finding ways to decompress, whether it's exercise or crafts or whatever it is. So it's important to do, all of that to stay strong mentally.
Good advice from Dr. Sudip Bose in Odessa, Texas. We appreciate it. Thank you.